All right, good morning, everyone. Some of you joined us a few minutes before 10, others just joined in. So I want to make sure that you are all welcome. We thank you for joining us for our fourth Multidisciplinary Approaches to End Homelessness webinar. We're very excited to have you join us today. We have two special speakers representing local cities who will be sharing on the work that their jurisdictions are doing to further the cause and end homelessness. My name is Tanya Torno. I am the manager for the Continuum of Care division. We have about 20 members on our staff who work within our fiscal, contracts, programs, and our HMIS, Homeless Management Information System, to coordinate about $30 million in both state and federal funding that is easily increasing as a result of the pandemic and the state and federal effort to create more housing for vulnerable and special populations like people who are experiencing homelessness. We decided to put on these webinars in early August. We had a planning meeting, and as the administrator for a lot of these different programs, we wanted to step up our game and increase the amount of technical assistance that we provide to our local homeless service providers and agencies. And so we felt that this would be a great platform where different agencies could hear from local experts. We recognize that there's a lot of local talent and a lot of good approaches that are innovative and unique to Riverside County that were worth sharing. So we certainly appreciate your participation here. We want to encourage each of you, if you have a program or would like to highlight perhaps a special project that your agency is doing to support our county's efforts to end homelessness, please contact us. We'd love to get you on schedule for our next webinar. These are held each month. We have already secured our speakers for December. We're looking at doing a focus on ending youth homelessness. And we are going to be having Operation Safe House and I believe United Way assisting us with that presentation. So again, if you are interested in sharing or speaking at our next webinar, please feel free to contact us at coc@rivco.org. Again, that email address is coc@rivco.org. So let's jump in and talk about what our schedule will look like for today. In a few minutes here, I'm going to be handing over the mic to Brian Ambrose, who is the Senior Manager with the City of Murrieta and a longtime member of our Continuum of Care. He is going to be sharing on the mission of the Regional Homeless Alliance, which is an alliance made up of local cities in the Southwest area, encompassing the city of Temecula, Murrieta, Menifee, Lake Elsinore, and Wildomar. Brian, along with one of his colleagues, actually created the alliance, which again makes it extra special to have him here today. After Brian's presentation, we have set aside some time so that you can ask questions. So at that point, you'll be prompted to unmute your devices and you can connect directly with him. Following Brian, we will be hearing from Hafsa Kaka, who is the Office of Homeless Solutions Director with the City of Riverside, and she is going to be sharing on the various strategies and programs that the city has implemented to support the cause. So with that, it's 10:06, a minute over my time. I'm getting better though. So Brian, I am going to go ahead and hand it off to you. Thanks again for joining us.
I appreciate it. I first, let me just start off by saying it's an honor to be able to speak and provide this presentation to everyone today. I know how busy all of us are. I know how busy we were pre-COVID, but I know down here in the Southwest Riverside County area, the last 8 months have been almost an absolute, it's been turmoil. It's been harder for our cities to collaborate. There was a point when we went into the COVID world in about March, where our police department were only responding to cases where they had to get involved, and basically we were told to back off with the communication and outreach to homeless. And so we did that for a certain period of time, and then we had to ramp it back up. So we're managing down here. I assume it's the same in every city out there, but just know I appreciate you being here. I know how chaotic it is and how hard it's been the last few months. So hang in there. We're all doing very well in this area, and hopefully we can come out of this as soon as we're able to in a safe manner. As mentioned, my name is Brian Ambrose. I serve as a senior manager down here in Murrieta. Typically, I always like to joke that my title should probably be changed to Director of Chaos. So in addition to homeless services and trying to create a more formal organization called Regional Homeless Alliance, I also oversee our CSD department, which has about 30 full-time employees, full and part-time employees, 52 parks, thousands of acres of open trails, and handling some of the largest special events in the Southwest region. In addition to that, I also oversee our library. The Murrieta Public Library is a phenomenal building. When I say I oversee it, to be honest with you, I'm very fortunate. It's literally the greatest staff out there. Every once in a while I walk over there and I get in their way. They certainly don't need me, but it is one of the issues that fall under my portfolio. Next slide, please. So how did the former assistant to the city manager and legislative guy at the city end up taking on parks, libraries, and homelessness? I got a feeling it's very similar to a lot of the roles that you guys have filled. It's a long story. And like many, I fell into it more out of default than education or experience. I do have a lengthy background in youth development, which does share very similar principles and solutions as homelessness. I started out my career, I was very fortunate, right out of grad school, I was able to take a job with the governor of Virginia. And in that role, I was responsible for leading 21 community coalitions throughout the state. And most of those were in disadvantaged regions. What we was change the paradigm of health policy. And by that, I mean, we try to implement an asset-based approach that promoted the protective factors of parent-child connectedness, school-child connectedness, and community-child connections. The entire premise of that program was that each community had the sufficient ability to develop youth programming that would promote assets in order for a child to be raised in a successful manner and be a productive member of society. But here's the catch in all of that. Only if the community came together and designed the framework, not if we came together from the state and said, you need to implement this, or the federal government, here's your best practices. In other words, the programming itself, it could only be as strong as the work that the community members put into the design. It's simply an ownership model. There's nothing groundbreaking about it, although we were doing some groundbreaking work back in the late 90s and early 2000s. It's common sense. It really is, just like a lot of the homeless solutions that we have in front of us. A lot of them are just simply common sense. But even before all that good work, there's a reason I was hired for that position by the governor. I spent a year of my life in drug rehabilitation, and I'm not talking about as a counselor either. I've been on my own since I was 17 years old. I was an addict from very early on until I hit rock bottom at about 25 years of age. I think this experience gives me kind of a unique outlook and a unique perspective that many don't have in local government in California, in Southwest Riverside County. It helps me personality-wise. I'm probably as blunt as anybody out there, so I'm allowed to lean back on that as my experience. It also lets me navigate the bureaucracy that we love to establish in all of our programming in government. So the one thing I've come to realize in this homeless arena that we all work in and that we all operate in is it's complete chaos. The nice rectangular programs that we create in city government, especially, and I've never worked for a county, so my experience is going to come specifically from working for 3 cities and 1 state government. But we love to create these beautiful rectangular programs in City Hall. And our city managers don't like it when homelessness comes involved because it's messy. It's a triangular peg that we're trying to push into that rectangular hole, and it makes it very difficult for them. And so that's the chaos we operate in. So today I'll briefly discuss homelessness in Murrieta, West Riverside County area, and we could talk about the inception of the Regional Homeless Alliance that we started here. I helped start with Robin Gilliland, Nicole Daly, and a few others. How each of our cities performs the outreach that we do, how our police departments have been just incredibly important to our success down here, and talk about some of our successes throughout the presentation. So please, next slide. So if you haven't heard yet, and I'm sure every single person on this conference call has, California leads the nation in homelessness. And there's a lot of reasons for that, and they are interrelated. As each of you probably get the phone calls from your residents, or you hear on blogs from the keyboard warriors, a lot of people have a singular solution or a singular cause of homelessness. I wish it were that easy, but it's complex, and we all know that. All of the reasons for homelessness in California are interrelated. First and foremost, the weather in California is different than the weather in the rest of the country. It just is. I'm from Philadelphia. When I grew up, I viewed California, and from everything I've seen on TV, from the sitcoms to everything, was California streets are paved in gold. Everybody out here drives a Ferrari and a Lamborghini and a Mercedes, and they get to trade it in every other year. That was my perception living in dreary Philadelphia growing up. And so you grow up and it's cold between November and about April. You start looking at Florida and you start looking at California. And it encourages people to come here. Secondly, there's the breakdown of the family unit nationwide. As well as the support system that the family unit typically provided, and it enable a person to overcome adversity. Again, growing up in Philadelphia, if I didn't have the family and the family unit to say, hey, probably not a smart idea to move out to LA before you finish school, before you get a job, and before you can afford to move out there, you move out there. It doesn't seem like it's a dumb thing to do, but in reality, it probably isn't the smartest. Number 3, California, up until very recently, we probably had the most lax laws on drug possession and use. That is not going to change. More and more states are legalizing drugs, and the enforcement measures that tended to help get people steer towards a detox or a rehabilitation center, that seems to be going away, and I don't see that changing whatsoever. We have economic forces such as the housing cost related to income. I'm very specific with that. Yes, there is an affordable housing issue, but primarily what I like to focus on is the housing affordability towards the income that you are receiving. So everybody's heard of the state actions. I'm not going to spend too much time on that, but AB 109, Prop 47, Prop 57 they've certainly impacted Murrieta. They've impacted all the cities in Southwest Riverside County, and I'm assuming all of the jurisdictions in Riverside County. Finally, there's the acceptability and the empowerment of homelessness in California, and this is somewhat unique. Our residents are overly generous. You can live on the streets of Murrieta and make a living. You can do it through recycling, you can do it through panhandling, and you can do it through running small scams, small cons. In other states, I've lived in Florida, Pennsylvania, Virginia, Oklahoma, a lot of different states out there. They don't have the permissive attitude that a lot of Californians do, and there's a lot of reasons for it. It allows a normalization of homelessness. I have a lot of debates with people about whether it's normal or not for a child to live in a car with their. I come from the background, I'm very blunt on it. It is not normal for a child to wake up in a car and go to their third grade class. It's not healthy, and they need support to get out of that environment. And we can certainly discuss that on a chat if you take an opposing point on that one. So the pictures that you see on the slide are the impacts to homelessness on major areas in Southern California. So what I want everyone to focus on these pictures, it's the scope of the problem in some of these areas. In San Diego and Orange County, each of them have somewhere between 7,000 and 10,000 homeless living on their streets or sleeping in their cars, garages. These are the point in time numbers. We all know point in time numbers are a good barometer, but they're not exact. They tend to be very conservative compared to what is actually out there. But both San Diego and Orange County have somewhere between 7,000 and 10,000 on the point in time count. Depending on the metric you use for homelessness, LA County and the city of County combined have somewhere between 50 and 100,000 homeless. And here's where, again, I tend to be overly blunt. Once you get to that level, you're no longer case managing homelessness. What you're doing at that point is simply attempting to reduce the ancillary impacts of homelessness. That's the hepatitis outbreaks, the crime, adverse impacts on the education for the youth that are living in that environment, and other public health issues. At that point, you're mitigating, you're not solving, and it makes it incredibly difficult to become successful at that point. Now, we're incredibly fortunate in Riverside County to have a point in time count of 2,800. But I want to make a few observations on this. The trends are going upwards. In 2017, there were 1,600 homeless living in Riverside County. That's an increase in 4 years of 75%. Second, everyone working in this field in Riverside County needs to be well aware that there is this vacuum in the Inland Empire. What I continue to hear in Murrieta is homeless individuals are moving towards our area because they feel safer here. They do not feel safer in the coastal communities anymore. There's a lot of violence. There's a lot of reasons they don't feel safe. I actually have a funny story. In one of our point in time counts, I think this is about 2 years ago, we were down in Murrieta Creek, and I was down with 2 officers, and there were 3 tents lined up next to each other. And it was very early. It was about 5:30 in the morning. And so we called everybody out from the tents. And out of 2 of the tents, 3 people came, a boyfriend and girlfriend and then an individual, but nobody came out of the 3rd tent. And this was what I think we usually do it on a Monday or a Tuesday morning. And we started talking with the 3 individuals, and we said, where's the person in the 3rd tent? And they said, well, he leaves for Hemet during the week. He's only here on the weekend. And we looked at each other and said, this homeless person literally has a vacation tent in our city. And we said, well, why is that? And without even batting an eye, they said, well, I wouldn't live in Hemet. So I don't feel safe in Hemet. So we come down to city of Murrieta. And that's when we started learning that they're homeless are looking for a few different things. They're looking for safety. They're looking for the path of least resistance. And they're looking for the ability to survive, most importantly. So I want to be really, really clear. No matter what we do as a region, we're probably going to have an increase in homelessness. 50,000 to 100,000 people live out in the city of LA. That's unsustainable. They're going to follow that vacuum of services, and they're going to follow that vacuum that provides safety for themselves and for their family. So we can create the greatest, most impactful programs, and we'll likely still see an increase. We can get as many people off the streets as we can, and we'll likely still see an increase. We need to prepare our local elected officials for that. I don't want anybody to have unicorns unicorns running around saying, hey, we're going to create these beds over in this city, and therefore we're going to get to zero homeless in this city. Hopefully we do. Hopefully we work that hard and get to that point. But the more successful we are, the more people in Orange County, in San Diego, when San Diego had their hepatitis outbreak, we saw an increase in Murrieta. They don't want to live where there's a hepatitis outbreak. Enough on that. So next slide, please. So the $1 million question I always hear from from the residents in Murrieta is, how many homeless do we have in Murrieta? And we're a little different here in what we call our little bubble. Our homeless population in Murrieta is incredibly transient. They move around far more than other cities, and there's reasons for that. First and foremost, we don't have the infrastructure in Murrieta for homeless. We're new to this game. There was nothing here before 2016 in terms of programming for homelessness. Outside of one nonprofit organization that we have here in the Temecula Murrieta region, which, by the way, is not part of the CES system, there are no shelter beds in Southwest Riverside County. City of Lake Elsinore has just purchased a property. They're gonna try and set up an emergency crisis stabilization center that will likely be limited to the residents of their city, and we're fine with that because they have to figure out how to solve homelessness in Lake Elsinore. But outside of that, I can either use a nonprofit organization in Southwest Riverside County that's not part of CES, or I have to export to City of Riverside, the Desert, Valley Restart, some other areas like that, or we don't have a space for homeless. Second, our police and our outreach efforts. We make contact probably far more often than most local jurisdictions do. Homeless like to be left alone. As I mentioned, they like to go to the path of least resistance. They also tend not to have good history with local officials, with police officers, or positive interactions whatsoever. We make it a point to contacting homeless as much as possible. Not because we're mean, but because we want to know exactly where they are. We want to know who's in our town. And most importantly, we want to check up on them on a regular occasion. We've had homeless individuals here in Murrieta die behind businesses. About 3 years ago, one of our longtime homeless gentlemen died behind a place right down in downtown area. And it was incredibly sad. It's the first time that's ever actually happened to me where I knew a homeless person that died. And so that tends to have some impact on you. We actually have had a few instances before where homeless encampments have tried to set up on property next to schools. And we are just very open and honest with our community. That will never be acceptable. We're never going to allow, in this case, there were 3 individuals there. 2 of them were sexual registrants. That's not going to happen. Not in Murrieta and not in the 5 cities down here in Southwest Riverside County. Third, as I mentioned, homeless go to the path of least resistance. In other words, if Lake Elsinore is enforcing trespassing ordinances, it's the squeezing the balloon principle. The homeless are going to get up. They're going to walk out of Lake Elsinore and they're going to go right across this arbitrary line to Wildomar or to Menifee. And then once Menifee and Wildomar get enough complaints, they're just going to go right back to Lake Elsinore. Finally, what I find here in Murrieta is homeless move around a lot because our public transportation system is not adequate for them, for their needs. If they need to solve a Social Security issue and they have to take the bus up to Hemet, it takes all day to get up to Hemet. And then a lot of times they can't solve the issue that day. And so a lot of times if they have to go solve a Social Security issue, they're up there, they're out of our city for a week at a time. So again, just incredibly transient. So in case you're wondering, on any given day, we have anywhere between 10 and 30 homeless in Murrieta. Our official point-in-time count number from last year was 18. We're very fortunate in that we have the lowest number of all of our neighboring cities, with the exception of Wildomar, and they have far less population than we do. I will say our homeless population, our visible homeless population, post COVID timeframe is going down substantially. There's a few reasons for this. First and foremost, what I'm hearing from our police officers, are a lot of the homeless have received worker comp benefits, incentive checks from the federal government, and there seems to be what I'm hearing, at least, as a EDD scam going on, where they're getting checks for substantial amounts of money, and they're checking into either hotel rooms, or they're pooling their money together, and they'll go in with 10 other homeless individuals and rent a unit, a housing unit, knowing that the homeowner cannot kick them out, that there's this moratorium. And so we're having an incredible challenge in our hotels as well as the rental units, where people they're racking and stacking 10 deep in these facilities. But out on the street right now, we were just out there on Friday, and I made contact with 5 of I'd say 3 of our regulars and 2 new people to Murrieta. That's down substantially, and I know where most of the encampments are. So it's fascinating, but I think we all know this is short term. This is when this moratorium is lifted, there's going to be some problems. So let's go ahead and change the slide. So what are we doing about homelessness in Southwest Riverside County? So in 2016, I was invited to a meeting by Robin Gilliland down in the city of Temecula. As I mentioned, at that time, homelessness was not a city issue. We all the cities around here said that's a social service issue. That's for the county. And so we didn't. All we did is, if I got a call from a resident of an encampment, I sent my officers. We have our own police department. I can have officers in an encampment within 5 minutes. All that did was squeeze the balloon. People left. They went down to Temecula. Temecula got the complaints. They came right back to us. We solved nothing. But in 2016, City of Temecula invited me down and said, "Hey, let's get together and communicate, figure out how to do this thing." And so we did. Our police officers started communicating. We started leading joint enforcement efforts. We created basically what was at that time as a top 10 list of homeless individuals, because we were seeing the same exact people. And then we came up with housing strategies for that top 10 and started moving people off of homelessness into permanent housing. And then we had this crazy naive thought of, hey, let's go to Wildomar, Lake Elsinore, and Menifee, because we know what we're doing. At least that's what we were naively thinking at the time. And so we went to each city council and we passed a resolution, a joint resolution of each 5 city councils. I can go to any city council and try to pass a resolution that says the sky is blue, and I'm telling you, there's going to be some opposition to that. Is it sky blue? Is it light blue? I would never get a unanimous decision from 5 different cities on homelessness. 5 cities passed a resolution unanimously that said we're going to work on this as a region, and we're going to try to break down these silos. And so we've been very happy with that stance. So next slide, please. So getting down to the nuts and bolts, you'll see that on this slide, our approach, which includes collaboration, coordination, and communication. This is all kind of enveloped in our responsible compassion approach. Some of the successes we've had so far in Murrieta, we've had successfully housed 18 individuals from Murrieta alone last year. While this might not sound like a lot, depending on the city or the jurisdiction that you come from, that's our point in time count number. And so we're really, really happy with that. In total, in the RHA area, we've had hundreds of people, well over 100 permanent exits from the street. So what's not listed on this approach, because it's qualitative rather than it's quantitative, it's the absolute breakdown of the silos that the cities have had. And I've never seen this before in my 25-year career in government, where our police department talks with our city staff. I reach out to the police officers in Temecula, reach out to staff in Lake Elsinore and Menifee, and it's working very well. And we're finding people. I just got a call from a family member that was looking for a gentleman who's got some severe mental health issues that's living on the street in Menifee. Menifee was able to tell me when they had the contact with him last. And that family will hopefully connect with their son. So next slide, please. What I want to spend the remainder of my time on, and I'll start wrapping it up here, is the commitment of Murrieta and Temecula in terms of funding, as well as our police departments. Both of us have 2 different police teams. One of them is a community policing team. This is a team in Murrieta. It's made up of 3 officers and 1 sergeant with a lieutenant overseeing it. That's quality of life issues. About 50% of that is homelessness. The officers have to apply for this team. through training. They are tested to see if they have the aptitude to be able to do this. Because let's be brutally honest, no officer went to police academy to work on homelessness. They went to what's called hook and book 'em. And for them to change their entire mentality on this homelessness takes a lot of work, and they have to have a certain aptitude. They have to have a certain character among them. The good thing is, the original 3 officers that started on this team, all 3 have been promoted to very exclusive task force after the community policing team. When we have an opening now on our CPT team, I have officers knocking on my door because they want to know what we're doing in homeless. If they can fit in that can join that team. And so we've been very successful there. The second team, and I really hope someday cities of Temecula and Murrieta get some national recognition here as a best practice, is our CBAT teams, our community behavioral health assessment teams. Both Temecula and Murrieta have a specially trained police officer on mental health issues that is partnered up with a mental health clinician, a clinical therapist from the county. And they full-time ride together in the same car, and they ride out to mental health call-outs. Here's the unique thing. When Temecula's officers, when their CBAT team is busy, they can call out Murrieta's team, and we go across the border, and it happens all the time. So barring an instance where there's 3 different calls on the same time for mental health, there is a CBAT team available. This is a very expensive, very costly proposition, but one that the cities are committed to doing. Cities of Temecula and Murrieta both passed sales tax measures, and I'm pretty sure everybody knows cities of Temecula and Murrieta are probably the most conservative areas of Riverside County, maybe all of Southern California. Both city councils went forward in the last few years to our residents and asked for a sales tax measure, and there were line items in those sales tax measures for homeless services. And that is what we're using to fund our CBAT as well as our CPT teams. And then I'm very happy to announce now all 5 of the cities in the RHA region have sales tax measures. Like Elsinore just passed theirs 2 weeks ago. And so we're going to start ramping up and really using this time and these teams to work together, to communicate together, and solve homelessness, not just move things along, not just move people temporarily into shelters, but to find permanent housing. So that in a nutshell is how we got started in the homeless arena, and how I kind of fell into it. I'll happily take some questions now. I'm not sure if Hafsa is online yet, but we can certainly open this up.
Hafsa has joined us, and because of time, Brian, we are going to go ahead and jump into her presentation, but we will allow for folks to ask questions after Hafsa's presentation. In the meantime, what folks can do, please type in your question into the chat box. We'll try to get to as many of those as we can after we have heard from both speakers. Anything that is not answered prior to this webinar, what we will do is work with the speakers to prepare written responses and then make sure that that's posted on our website with the video link and the PowerPoint presentation. But Brian, thank you so much. The feedback in the chat box is positive. People love to hear that you are using behavioral health specialists, mental health specialists to work with law enforcement to support the homeless population. Now jumping over to our next key speaker, I'm so excited to introduce Hafsa, Kaka, who is the Officer of Homeless Solutions with the City of Riverside. Like Brian, Hafsa is very involved with our continuum of care. And as we all know, the City of Riverside has a emergency shelter planted in their city, which we are all familiar with, Path of Life Ministries. We're very thankful to have her here. Hafsa, at this point, I'll go ahead and hand it off to you. Thank you for joining us.
All right, good morning. Can you guys hear me? All right, great. So first of all, I want to say thank you firstly to Melanie because she has been so helpful behind the curtains trying to get everything ready for this presentation. So Melanie, shout out to you. I had to get you a whole bunch of stuff last minute because we're working on so many different projects. So my presentation today, I kind of brought everything together. I hope not to find any outdated stuff, but we are just moving at such a fast pace. So I may have to make some corrections. And also, Tanya, thank you for affording the opportunity. When I saw the series, I said it would be great for the city of Riverside to participate. And then I'd like to begin my presentation by thanking the Office of Homeless Solutions, the city of Riverside, our mayor, our council. They have been very, very supportive. Michelle Davis from the Housing Authority has been leading so many of the efforts and has been doing this for 20 some years. So I want to thank her. And of course, Shalia and all of our outreach workers and everyone who's involved with the Office of Homeless Solutions. Brian, that full presentation, and I do want to piggyback off of some of the stuff that you said, especially about the importance of creating an infrastructure. I know that you mentioned that you guys are sort of starting off, and as the city of Riverside being a city who has been heavily involved and in the business of providing services to the homeless community for over 10 years, we are happy to lend our expertise and definitely happy to encourage cities to create that infrastructure to be able to address homelessness. So Brian, thank you for mentioning that. So with that being said, let's go ahead and get started. Can we go to the next slide? So just a little bit of a context, as you all know, the point in time count as of 2019 throughout the county, over 2,000. With the city, what was reported was there was upwards of 439 unsheltered individuals. And then, of course, in 2020, over 587. We know that that number is actually higher. So that is definitely something that we in the city of Riverside, we are the largest, we are impacted the most in the entire county with the most unsheltered individuals. And then going on today, I'm going to talk about a lot of the infrastructure and the shelters that we have that also indicate that we have the most sheltered as well. So you can see there's an uptick. And I will say that one of the things that I wanted to, I joined the city of Riverside, actually it's been 1 year this month, and I came from Orange County as their homeless services manager, and also from LA working at Los Angeles Homeless Services Authority. And Brian's right, there's a huge population there. I worked in Skid Row alone had over 20,000 individuals, and now the city of Riverside, or the city of LA has so much. So we're lucky to work with the population we have, but especially we need to work quick and work fast and create our infrastructure, programs, and services. All right, next slide. So one of the things that we did see with the stats to the prior slide, I didn't indicate it, but one of the things that I wanted to implement was really trying to see how many folks are from the city of Riverside. And the reason that's important is because we have different channels of funding and different channels coming from local Measure Z dollars, state funds, and then federal funds as well. And so it's really important to be able to allocate the appropriate funding. And we actually found through our city census, especially working with our Path of Life partners in terms of how many individuals originate from the city of Riverside, we found that only 37% of those who are accessing shelter are from the city of Riverside, and that over 50% of the individuals that are within the city that are outreached through our staff is actually from the city of Riverside. We've seen people from all over the county, and we've also seen people that are from out of the country. We've seen people from Bangladesh, from Mexico, from just different Australia. We've seen people from different parts of the states, Arizona, Nevada, and so we know that we're working with a very diverse population, and also we want to encourage other cities to continue to work with us because we see the rest of the cities and county folks coming to our city's access center, which I'll talk about. Our approach is very comprehensive, so we have services, we have housing, and we have quality of life. Services, obviously, I'll delve into it. A lot of it lies in our Hewlin Campus Collaborative. Housing is really with our Housing Authority, which Michelle Davis oversees. And quality of life, similar to what Brian was saying, we have our PSETS team, which stands for Public Safety and Engagement Team, which is a multidisciplinary team that has code enforcement, law enforcement, outreach workers, and of course, vendors to help clean the many impacts into our community of homelessness. And I'll get more into that. Next slide, please. So what does the Office of Homeless Solutions do? So what's really unique and what really attracted me to the city of Riverside with the diverse, privileged background that I have working in different communities is the fact that the city actually, with our leadership of our city manager and our mayor and city council, established an actual Office of Homeless Solutions. This is pretty unique because I've seen positions being leveraged in different cities, whether it's from police or whether it's from code, but we actually have an entire office. And within the office, we have our housing authority. We're direct service providers. So we do have staff that are hired within the city that provide outreach services. So one of the things that we have is our Access Center, which is on 2880 Hewlin. Anybody could walk into the Access Center between the hours of 8 to 4, with the exception of lunchtime, and really access the services on how they can gain shelter, how they can get supportive services, case management. They could apply for health benefits and really understand the navigation, employment, referrals to medical and health clinics, mainstream benefits, transportations. We also do trip homes. We've done quite a few trip homes, rental assistance and case management. I think most recently we had sent an individual back to Nevada, Alaska. There's just been so many benefits to our Access Center. And I really have to give it up to our Access Center staff. They work diligently hard. I think sometimes we see a lot of different struggles. One of the biggest struggles that we see, that we have been seeing, is hospital drop-offs. And I brought this to the attention of the COC because it is real and it happens. And so there's always that 4 or 5 o'clock call in the afternoon saying, Hafsa, we had someone dropped off here. How could we assist? And so our city is rambling, our office is rambling to make sure that that person who's recently dropped off from hospital, who has vulnerabilities, who's medically frail, is getting the services. So we work diligently, our staff works after hours to make sure individuals are sheltered. Next slide, please. So our infrastructure and our system of care is what we call it. System of care is, you've got the homeless individual. We start off with outreach. And so we actually have, not only did I mention, our own outreach through the Office of Homeless Solutions that goes in their van, and daily we have an infrastructure called the 311 system within the city where folks can call from the community, residents, businesses, anyone, and say, hey, I'm concerned there's an individual on the corner of Walk and Don't Walk. How could we help? And so we will go ahead and send out our outreach workers. We also went ahead and most recently, over the course of the last year, executed a contract with CityNet, and CityNet is an operator that has established themselves in Orange County and also San Bernardino, and I think in a city in LA. I used to work with them in Santa Ana, and they've done an incredible job also doing targeted outreach. They do targeted outreach and case management with families, and also we went ahead and we have COVID outreach as well. We ramped up our outreach services. So we work in tandem with both our Office of Homeless Solutions staff and CityNet staff. Contacts are really important. Our team is working daily to connect with the COC staff, Home Connect, County Behavioral Health, Family Services, to make sure that individuals are getting the services that they need. We in the city have really ramped up our shelter. As you know, Path of Life Shelter is their entity, and we do have a few beds that are for the city itself within the shelter. We're very proud of Path of Life in the sense that they have most recently made themselves a 24-hour shelter, which we definitely provide kudos to, because we do know that homeless services doesn't stop at 4 o'clock. So we really appreciate that partnership, and they are right next door to our Access Center, so there is a seamless partnership there. We also have our CityNet operator for our pallet shelters, which I'll later. Transitional housing is something that we've also been working with in terms of tenant-based rental. That's actually a housing, but we have established transitional housing in terms of bridge, and then permanent supportive housing and wraparound services, which is really through our housing development projects, which I'll get into a little bit more under Michelle Davis's leadership. And then of course, self-sufficiency. Next slide. So this is our campus collaborative. It's a cul-de-sac. It's the Hewlin campus, and that parking lot right there actually most recently was last March completed with our pallet shelters. So with our mayor really leading this effort, and now it's really become a national best practice because I've had San Mateo, Oakland, Hawaii, LA. I've had so many different cities call me, Berkeley, San Diego over the past couple of Seattle, past couple of months, because we literally launched this non-congregate shelter for pallets. They're mini tiny homes, and they actually are perfect for non-congregate. And we understand the importance of non-congregate now, especially with the onset of COVID. So we didn't know it at the time that this is going to be a best practice, but it certainly has been. And we quickly, literally, council approved this. Our council meeting went up to 1:30 on December 17th because we provided them with so many options, 1:30 a.m. And council did approve 30 pallet shelters to be in our parking lot. Within 12 weeks, we were able to move in the first folks, and it was really multidisciplinary approach. We had our general services, we had our fire, we had PD, we had public works, we had the pallet community. It was really all hands on deck with Office of Homeless Solutions, City Manager's Office. Everyone worked together to get these pallets going. And so you'll see next door, obviously Path of Life, and of course the County Behavioral Health, the place, really happy about the partnership there for permanent supportive housing. Helping Hearts is going to be coming on board. Originally it was 28. I think we're still figuring out some of the beds, but it's going to be really exciting to see these mental health beds, and bridge housing, which is going to be another bridge housing opportunity that we'll have next year. So these are all additional shelters and additional housing capacity that we have created. Next slide, please. So this is the pallet shelters that I was talking to you about, and it just kind of looks like that.
Hafsa, you've hit your mute button.
Can you hear me now?
Yes.
Okay, great. And I'm talking like I'm from New York because we have so many programs and services. I have to talk really, really fast. So emergency shelter cabins is sort of what we call it with our village. And CityNet does the case management and services. 2 people could be in each pallet. However, right now with COVID, we're only allowing couples. It's a very warm and very beautiful environment. CityNet's providing 3 meals a day, case management services. And when council approved this, we really did it as a system of care back last year in December because tenant-based rental assistance program was also approved. So you got outreach, you got shelter, and then you actually have an exit plan for these individuals. And I'm proud to say, if you go on to the next slide, you'll see some of the press that we received on that. If you go on to the next slide, please. The mayor, he camped out. He camped out in this, prior to it getting on board because he really wanted to show the importance that, folks were dying on the streets. And we really give kudos to that. CityNet did an excellent job, as you can see. Next slide. And a great example is Peggy. Peggy has made herself well known. The governor Governor Newsom came and visited our Access Center back in January of last year, got an opportunity to meet Peggy with Mayor, and she was given a key to a pallet shelter. And we worked closely with Path of Life and the county to get her connected off the street into our pallet shelter, and then into her last picture right there where she is happily in her own home. And all of that happened within about almost a month, so very quickly. Next slide. So speaking of shelters, additional shelter, we went ahead and we also received 15 trailers from the state as part of a COVID response. A lot of big cities, we're part of the Big City 13, which are cities that are heavily impacted by homelessness and are quite dense. And so our mayor advocated, and so we are part of Big 13 funding for the state. And with that, we received some funding through COVID. So we went ahead and we operationalized that into these trailers. It was functional from April to August 2020, and we went ahead and had CityNet also also do the seamless operations as part of their continuity of care from outreach. This required project room key requirements, and so there were highly vulnerable individuals as well as seniors. And what was the most beautiful part about it is that we ended up actually supporting a local business during this rough time during COVID, and the fact that we had this at our Riverside Airport parking lot. And so it was just a walk away to service the meals for the individuals from our local cafe. So this was really innovative, that we were not only able to serve individuals experiencing homelessness, but also support our local business during this crisis. Next slide. More shelter. So as part of a response to the unsheltered population, we also went ahead and created a program called a MAP Home. MAP stands for Massachusetts Action Plan. And as you all know, we had one of the largest encampments aside from the river bottom right here in our backyard at the Hewlin campus on Massachusetts. So on August 4th, our city council actually approved an expenditure plan for the Corona Aid Relief CARES Act. And we received as a city $28 million, different cities all across the, all across the counties, they all got different CARES funding. We did a community survey to make sure that voices were heard, and we were able to actually receive upwards of $10 million as a response to homeless and housing. We went ahead and allocated $2 million of that funding to address this project alone. And this project literally happened and ramped up within 2 weeks. I went ahead and implemented best practices for a 6-tier plan on data-driven outreach, shelter, permanent housing, safety, and beautification and renovation. And so what we had is we had CityNet do a quick census. We found that there was upwards of 100 people on Massachusetts, and that about 50% were from the city of Riverside. So we worked really hard to do some family reunification. We also saw that there were quite a few that had mental health and behavioral health. And so very quickly we ramped up with our CityNet staff, our Office of Homeless Solutions. And, I really appreciate, we got 2 staff from the county behavioral health. Thank you so much for that. And we were able to get them connected to some county services. And then also the shelter that was part of this was a motel that we went ahead and mass released with our operator to provide bridge. What made this a little different is that the motel was 24 hours. It was a 24-hour bridge housing, meaning that if we found someone at 7 p.m. or 8 p.m. at night, CityNet was working and they could go ahead and get that person into the shelter. Same thing with our pallets. It's 24 hours. So if tonight I get a call at 9 p.m. that someone's on the street, that's, they're ready to accept shelter and we have bed, our work doesn't stop at 4 p.m. At 9 p.m., our PD and CityNet will work hard to get that person into shelter. And I think that's very innovative and very so we were able to do that. And then of course, permanent housing placement with tenant-based rental assistance. And then of course, safety, we got our police department involved. This was really important because we do have, and we have seen that there's been very sometimes hostile environments. And we were able to not shy away from it, but really involve our police department and probation to help us. And of course, beautification and renovation to support the businesses. Next slide. All hands on deck, like I said, that just has all of the, providers, even Union Pacific Railroad, which was really important. And of course, Path of Life, you were part of this as well. We really appreciate, and some other nonprofit providers as well, including Operation Safe House. Stats, we were able to get 63 folks placed, and we were actually able to get a lot of youth placed as well. So that was really exciting. Next. We did a very inspirational video. If you get a chance, please go ahead and take a look at our Instagram. And as you can see right there on the left, we also have our county behavioral health therapist that's paired up with our PD. And of course, CityNet's right there providing the key to the motel. And the picture to the right at the bottom, there was about 80 tons of debris that was actually picked up, and the city picked up this cost. And this was very, very important because we want to make sure, especially during COVID, that we're not only getting folks into services, but we're also making sure that there's a clean environment and not a contagious environment for any unhygienic issues. So that was the real success. Next slide. more shelter beds. So, I talked about the map home. I talked about, obviously, Path of Life has been with the city for a very long time. I talked about the pallets. In addition, council went ahead and approved shelter and respite beds for recuperative care. So we're really excited about this. Earlier, I mentioned about hospital drop-offs. So we are going into partnership with Illumination Foundation and IEHP to service recoup care beds. I just got a note saying I have very few minutes left, so I'm just going to really run through all this. So we're really excited to see this come into fruition in December. Next slide. Okay, so Housing Authority, and maybe you guys could invite Michelle to come back because she has done incredible work with a lot of housing projects, but bottom line, 534 total units of affordable housing, 229 permanent supportive housing. So I sort of talked about the front end of stuff in terms of shelter, and this is permanency. So, Michelle has worked really hard with her team to get aggressive with No Place Like Home and other affordable housing. Next slide. Rental assistance program. We also went ahead and utilized some CARES funding for that, and we've partnered with Fair Housing Council. Next slide. These are all the locations of our affordable housing. Next slide. I'm like going Zoom. Mission Heritage is going to be a wonderful partnership with 72 units of affordable housing. Next. Cedar Glen, 50 units of affordable housing. Next. St. Michael's, this is really exciting. This is also 50 units with No Place Like Home, 4.3 million. Next. Oasis Senior Villas, 95 units of low income for senior housing, which we know is also on the rise. Next. Homelessness Housing and Prevention. So we were part of the big 13 cities, and I kind of talked about that. We could skip this one. Next. And if you have any questions, please go ahead and call our 311. You could call the Healing Campus, and you could call, obviously, my office. We're doing so much work, and just to kind of end it, I just want to say that it really takes teamwork from our mayor, our city council, to our administration and city manager's office, and of course, all of your partnerships. So we are happy to continue to work with all of our partners on this call. Thank you.
Thank you, Hafsa. Great job. I'm hearing an echo. Thank you so much. But lots of good feedback to both you and Brian. You have lots of people cheering you on. Some person or an individual, my apologies, texted me to say, I am in tears just hearing about all the work that is being done across both teams. So keep it up. I want to make sure everyone is aware that we are uploading the video in addition to the PowerPoint slides on our website. I included a link to our website in the chat box, and we'll make sure to send out an email with that information as well. We have 2 minutes, so I do want to take advantage of allowing folks to ask some questions. Brian, for you, there was a question from Greg Rodriguez wanting to know, how did you market tax issues for your homeless program?
Is only for my closest 20-some people or whatever is on this conference call. If you've ever been involved in campaigns, public safety sells. And so we sold it to the community in terms of public safety. Here's what we're going to do with our police department. Here's what we're going to do with our. With that being said, we did not have an aggressive campaign for a few reasons. First and foremost, City of Temecula went out, I think, 2 years before we did. And they had a very aggressive campaign, got out there, and it passed overwhelmingly. To be honest with you, our strategy was, hey, look at what Temecula is doing. That's what we're going to do. And so we really just kind of dovetailed into what they had already done. City of Temecula put together an incredible website in terms of what they were going to do, and then updated it with what they did. And so we literally just said, hey, whatever they're doing, that's what we're going to do. We're very fortunate that our community backs our police department and our fire department an incredible amount. And so we did not do as much campaigning as many other cities had to do and expend that political capital. But we were very honest. We're going to do this with our police department. We're going to do this in homeless, and we're going to buy these numbers of fire departments. I was not very much involved in it for two reasons, actually. Excuse me. In the recession, I helped pass an EMS subscription program that saved a fire station from being closed down. That included a fee, a new fee on City of Murrieta residents. And then about 2 years after that, I was part of a team that passed the development impact fee increase for our developers. And our city manager at that time, who's since retired, asked me to do the campaigning for the public safety. And I said, absolutely not. Our city council is, I'll work myself out of a job coming forward third time for a new fee or something like that. So in short, City of Temecula did a great job. We dovetailed off of that, and our community very much supports public safety.
Tanya, can I just intervene because I saw Catherine Hansen is on and she's newly elected to our BOG from UCR. And Catherine, I remembered it as I was talking, but I had to rush. We also have a contract with UCR that we are going to be expanding into a medical clinic with our Access Center. And of course, Catherine Hansen has been a big leadership in that as well. So just wanted to say we're also going to be providing medical health services via our Access Center through UCR Health Clinic. And then in that note, I also have to mention, I just came downstairs from a check presentation with Salvation Army, who's also part of the city, and we're going to be having an employment pilot program with them that is funded through Molina. That's going to commence in February, and of course also our Love Our Neighbor and our faith-based providers. So, and of course the Grove that really was with the Love the Neighbor. And one more thing before I forget, the Now program, where council had approved back in this summer to move some funds from our PD, from our police department, to supportive services to establish a medical outreach nurse program, and I'm calling it now Nurse Outreach Worker. So council has been very supportive from taking from enforcement to programs and services. Thank you.
Thank you. Great job, Brian and Hafsa. Our staff will follow up with you after to make sure that we review if there are any additional questions in the chat box, and we can prepare a quick Q&A document that can be uploaded with the PowerPoint, the video, and any other supporting documentation that your teams may have to share. All of the information will be posted on our Continuum of Care website. I included a link in the chat box, and we'll make sure to share that. And to our guests, we also want to send a special thanks to you for participating. We had 50 participants on this call, which is incredible, and we truly appreciate you jumping on to, again, check out the local talent we have in our county and all the incredible work that is moving the cause forward. So thank you, Brian. Thank you, Hafsa. Keep up the good work. We appreciate you all, and we'll see you very soon. Take care.